Hey everyone, welcome to your go-to exam prep guide for communication disorders. We're going to cut right through the fluff and focus on exactly what you need to know to ace your test. You ready to really get a handle on this? All right, let's dive in. So, here's our game plan. We've got 6 key areas to cover. We'll kick things off with the basics, then get into the 3 main types of disorders you'll see. After that, we'll look at treatments, the emotional side of things, some super practical communication strategies, and we'll finish up with the one principle that ties it all together. Let's get started. Okay, first things first, where do these challenges even come from? Let's build a solid foundation here in section 1. So almost every time, these conditions are triggered by something major happening in the brain. Could be a stroke, a head injury, a tumor. You get the idea. The key thing to remember for your exam is that an injury or a disease messes with the brain's incredibly complex wiring for speech and language. All right, our first big term, aphasia. Now listen up, because this is a super important point for any test. Aphasia is about language. It is not about intelligence. The person's mind, their thoughts, who they are, that's all still there. It's just the ability to pull out the right words or understand them that gets scrambled. That distinction is absolutely crucial. Okay, so we've got aphasia down. Now let's zoom in on the 3 main disorders you're definitely going to see. Nailing the difference between aphasia, apraxia, and dysarthria, that's going to be a game changer for you on those tricky questions. Aphasia itself kind of breaks down into 2 main types. First, you've got expressive aphasia, also called broca's. Think of this as broken speech. You know exactly what you want to say, but getting the words out is a real struggle. Then there's receptive aphasia, or Wernicke's. Here, the problem is understanding. The person can speak fluently, but the words might come out all mixed up, kind of like a word salad. And, there's also global aphasia. This is the most severe form, where a person has major difficulty with both expressing themselves and understanding what others are saying. It's really tough. All right, let's nail this down because it's a classic exam question. What's the difference between apraxia and dysarthria? Well, think of it like this. Apraxia is a brain planning problem. The brain knows the word, but the signals to the mouth muscles get all jumbled. It's a coordination issue. Dysarthria, on the other hand, is a muscle weakness problem. The plan from the brain is fine, but the muscles are too weak to actually form the words correctly, which leads to slurred speech. So, for your exam, just burn this into your memory. Apraxia is planning, dysarthria is weakness. So now that we can identify these disorders, what do we do about them? Let's move on to the hopeful part. The treatments and the amazing technology that can help people communicate. The number 1 treatment, the gold standard, is therapy with a speech-language pathologist, or an SLP. These are the experts who work with people to essentially retrain the brain, build back skills, and find new creative ways to get their message across. And they often use communication aids. These can be super simple, low-tech tools like a board with pictures or letters that a person can just point to, or they can be incredibly high-tech, like a tablet or a special device that can actually speak out loud whatever the person types or selects. The goal for both is the same, to give that person their voice back. Okay, we've talked about the clinical stuff, but we absolutely have to talk about the human side of this. Communication is everything, right? It's how we connect. And when that gets taken away, the emotional fallout can be huge. Just try to imagine for a second not being able to say, I love you, or ask for what you need, or just share a simple thought. You can see how that would lead to intense frustration, maybe even anger or anxiety. It's not surprising that depression and feeling totally isolated are really common. That's why understanding this emotional piece is just as important as knowing the science. All right, now for what I think is the most useful section. Let's get into the practical, hands-on skills that you can use to make communication easier and more meaningful for everyone involved. Here's your checklist for effective communication. First, and this one is the biggest, just be patient. Give them time. Don't finish their sentences. Next, turn off the TV, reduce distractions, make it a quiet space. Start with simple yes or no questions if you can. And please, always use a normal adult tone of voice. Remember, their intelligence is intact. Use your own body language, gestures, facial expressions to help get the message across. And finally, repeat back what you think they said. So you're saying you'd like some water? It shows you're really trying to understand. And here are 2 more absolute game changers. 1, make sure their communication tools, whether it's a picture board or a tablet, are always within reach. And 2, acknowledge their struggle. Just saying something like, I can see this is frustrating. It's okay, we'll get there together, can make a massive difference. It shows you're a partner, not just a bystander. So we've walked through the causes, the different types, the treatments, the strategies, but all of this, every single bit of it, really just points to one single powerful idea. This is the most important takeaway of all. Let this one really sink in. You are communicating with a whole person, not just a disorder. Behind the slurred words or the struggle to find a phrase is a person with a history, with ideas, with feelings, with a soul. Always, always remember to see the person first. So, as we close this out, I'm going to leave you with a question to think about. How will you take these strategies and use them to communicate with real dignity and respect? Because at the end of the day, this is so much more than just information for a test. It's about how we connect with other human beings. Thanks for tuning in.